It is my privilege to start this series where we're going to be meeting some of the most influential dentists in the world. And it's my privilege to start with a great friend, an expert cosmetic dentist, Dr. Andrea Clegg.
Hey, Alan, I'm so excited for this.
Are you nervous?
No, I think it's nice to be here with you.
Okay. Oh, perfect. Listen, so I want to jump right in. How do you find the world of cosmetic dentistry in 2025, particularly as a woman and someone who is making great leaps in the industry and someone who has learned a lot, but is still on a journey of discovery as well?
Absolutely. I think 2025 is a great year to be a cosmetic dentist. Truly, I feel like the trends are kind of going to a more natural look. I think it's very approachable. I think being a female in the cosmetic dentistry market initially can be a little bit difficult, but as you kind of blossom into that role, I feel like a lot of women, which is a kind of a primary driver of the marketplace, kind of seek that kind of woman-to-woman attention and attention to detail. And so I actually feel like it's an advantage at this point to be a female in the marketplace.
And I think that market, as you were saying, has shifted and changed. Tell me about the kind of more natural look that's coming in and still being really refined in the way that it's done, but a different expression rather than that, brassy, shiny white aesthetic that was very much present.
Yeah, I mean, I think that women are seeing, and men too, are seeing themselves more in photos, videos, high resolution. They're realizing that they want something that is refined and elegant, but isn't going to be the first thing that people notice about them, if that makes sense. It's not going to be your first impression is, oh my gosh, do you have veneers? So I feel like there's definitely a shift in the marketplace, especially at this time of year, 2025, and it's going to be like more levels of translucency. I think patients are getting more educated about the fact that they don't want their teeth cut away. So I think minimally invasive dentistry is a big trend. They understand the collective effect of what a smile can bring, and they don't want that necessarily to be something that just enters the room before them. That makes sense.
And I think that's the thing. Like, it's every smile has to be unique to the individual.
Yes.
And you have to have that skill set to be able to design that really appropriately for that person. It can't be an out of the box solution.
No, and one thing that I was trained to do at Beam is basically to address each patient individually and to look at their smile within their face, within the frames of what their natural teeth look like, and try to keep some of that DNA in there. So there's a big design element that comes in cosmetic dentistry, and I feel like that's something that we specialize in. And it's really kind of setting the mark, putting it on the teeth, letting the patients experience that so that they can provide feedback. And it's not as much of a lab-driven process as it is a dentist-driven to communicate with the lab for a better outcome process.
So whenever we go through this, you've touched on smile design, you've touched on communicating with a lab, you've touched on how you have to really refine the design of a veneer or a crown specifically for that patient in terms of translucency. It's a lot. Okay. So like, what would be your advice to a young dentist, maybe a few years qualified, who wants to take that next step, maybe starting cosmetic dentistry for the first time, or from your own story, the way you did it, what would you advise them now at this stage if they're scared?
Well, I guess now would be a good time to talk about something that we're doing together, if that's okay with you. Alan and I are creating a curriculum for this type of, basically jump into that type of marketplace. So when I was just starting out as a cosmetic dentist, there wasn't a lot of really approachable classes that I felt like I could take that was a comprehensive approach where I would feel confident in doing this by myself.
Yeah.
And so I sought mentorship from many accredited American cosmetic dentistry dentists, and it allowed me to really understand this bespoke process. And so that is something that we want to help, dentists that are, first-year dentists or third-year dentists or 20-year dentists to try to kind of integrate into their practice with predictability. And so we are creating a class called
The First Veneer.
Yes.
Yeah, so this is good. This is going to be something that we're going to work on together, which is a way of having that entry level point if you're scared of making that leap into cosmetic dentistry, or you feel that this isn't the wheelhouse of skills that I already have in my practice, but I really want to do it. I think for us, it's been really important to have mentors.
Yes.
And to have people that you can trust, that you can ask silly questions to, and not feel that like you're being judged. And if we can create that pathway, because it is complex and cosmetic dentistry takes time, but also I think something that maybe we can talk about is it's really important to have the skills and the training, but also to be super relevant, to understand what the trends are and actually how the market is moving and how you brand and market yourself within the whole ecosystem that is dentistry.
Yes, and understanding your ideal patient, understanding the marketplace, understanding the trends, all of these things are incredibly important when you're looking at this type of industry. And so experience is wonderful, but also relevancy is huge and key, and something that we've really found.
Well, you know that I've talked about branding and marketing a lot in the UK, and you have really refined the way that you do your own dentistry here. You treat a lot of high net worth and celebrity clients. You're in Nashville, country music city.
Yep.
You've had to understand that relevancy piece from the get-go.
Yeah.
What do you feel that's been a barrier, for instance, within dentistry that we can help people overcome in that?
Yeah, so I think like the ability to tell your story. Like I think each person has an individual story that they're trying to communicate. Like not everybody is the same. Every dentist has an individual technique, an identity, a practice identity, an ideal patient base. And I think that there's no wrong answer in that, but it's really just kind of finding the narrative and how to create the expression in the marketplace where you can share how you feel on the inside with the outside world.
Yeah, and actually, if we can communicate that to patients, telling our stories so they can understand who we are as patients, is vital. Yeah. You're great at that.
Thank you. And I feel like it actually makes your life a lot easier when you are putting yourself out there, as scary as that sounds. These patients are consumers and they're viewing you and they're understanding who you are. And so when people approach me for a consult or to do their veneers, they've vetted me. They know that I am who I am. They understand my style. And they want to be a part of what we're creating. And so I feel like that's really important.
How do you find UK dentistry? So let's take this global. So UK dentistry gets a bad rep sometimes globally in terms of the traditional view of British people's teeth. And US dentistry has always been seen, we were always taught like US dentistry is 10 years ahead. And that's something people in the UK will understand. How do you find things are shifting now? How do you feel that you can make an impact and have a voice in that?
Yeah, sure. So, I mean, just the trends I've observed, and correct me if I'm wrong, in the UK, there's a lot of composite bonding. And there's a kind of a mentality that I hear over and over from my colleagues of there's no place for this in the marketplace to do high-end cosmetic dentistry, like that people can't afford that. But we all know that it's really creating your own market. Like a lot of dentists that I would talk to here in Nashville, even if I were to say, oh, I'm going to charge this for a veneer or I'm going to do these high dollar cases, they would say, well, I've talked to my patients about it and they just won't do it. So it's really about like redefining sort of what you're putting out there, putting the value behind it.
I was going to say the word value is key.
Yeah.
It's not expensive. It's understanding how to attribute value to something.
Yeah. You want something that's going to last. You want something that's going to look great. And you want something that's going to feel like you at the end of the day. Like when you look in the mirror, you want to feel like yourself. And I think that that's really important. So I think that just kind of techniques that we use in the US might be a little bit different than the UK. We definitely use some types of porcelain here in the US that are a lot thinner and a lot stronger than kind of what we've previously been taught. And so I think bringing these concepts to the marketplace and making them mainstream is just really important for like the community of dentistry as a whole, so that all of us can kind of improve the patient experience together.
And you got to meet a lot of UK dentists at Pace Presents.
Yeah.
Do you want to say anything about that?
Yes. So that was the funnest thing I've ever done. We got really taken out of our comfort zone. We got to meet people from all over the world, and now we have friends and networks from all over the globe. And I think that that's a really unique thing. I think that we've always looked at it as UK dentistry or American dentistry or Irish dentistry or however you want to approach it. But I think the world is getting smaller. We're all watching each other's social medias. We're all seeing what each other's doing. We're seeing how we're influencing the marketplace. And I feel like the future is together. And I feel like you created a really good forum for people that are doing different things and have different superpowers, if you will, to kind of come together and build a community and kind of take off from there. So I'm really excited for next year. And
just to wrap up, would you have any advice to a young dentist in the UK?
I don't know. What do you think? Do you think there's something that...
Well, if you were someone that was starting out and they want to get into cosmetic dentistry, they see a lot of things on Instagram, and sometimes they feel overwhelmed or they're scared that their work's not good enough to post. What advice would you try to dispel any fears?
Well, I think posting your work is actually important, just even from like an internal checkpoint standpoint. Like I'm seeing my work progress over time and I'm being accountable for how my work is improving. And I think that that's really important. But I do think finding a great program that teaches you smile design basics from the beginning to the end, because there's a lot of things that we can learn, bespoke techniques that are going to work, because I think a lot of times dentists are scared to try things because they're scared that they're going to fail. And I think that it's really important to find reliable, repeatable systems that don't fail so that you can feel confident to kind of do what you do.
Andrea, thank you so much.
You're welcome.